Adjuvant cancer therapies are used to support and to enhance the effects of primary cancer therapies in eradicating or reducing cancer's burden on the body, and to help to prevent cancer recurrence and to increase the survival rate. For example, surgery to remove a brain tumour would be a primary therapy, and chemotherapy given before, during and after the operation to help to stop the cancer from coming back would be an adjuvant therapy. Although adjuvant cancer therapy usually refers to conventional cancer treatments, the term can also refer to evidence-based integrative interventions with the same goal. The intention of this protocol is to review integrative and novel therapies, including natural interventions and off-label use of some common drugs, which have potential value in the setting of adjuvant cancer care. There's many integrative therapies that can be helpful in adjuvant cancer care. However, not all are appropriate for everyone. Although elimination of cancer is ideal, attaining equilibrium may be equally effective in terms of patient longevity and quality of life. Cancer has a unique place in medicine. In 1971, President Nixon declared a war on cancer and signed the National Cancer Act into law. For decades, this adversarial tone took us down a path that aimed to find better bombs like chemotherapy and radiation, rather than try to understand the characteristics of this enemy. Through advances in scientific techniques and our ability to collect and analyze data, more is known about this enemy today than ever before. These developments have helped to uncover much about how natural interventions can affect cancer. There are important biological differences between preventing cancer from developing in the first place, or carcinogenesis, and preventing cancer from growing back, or recurrence. The goal of adjuvant therapy is to prevent the recurrence by controlling the growth of cancer cells that may be present already in the body. The tumour microenvironment is the area around a tumour, and it consists of cancer cells and non-cancerous cells, along with many other biological substances. The components in the tumour microenvironment influence whether or not the cancer cell will divide. The microenvironment presents many opportunities for adjuvant therapy. A key goal of adjuvant cancer therapy is to maintain a microenvironment that's not conducive to the growth of cancer and instead promotes its dormancy. It's now accepted that cancer cells arise in the body more often than previously thought, and that immune surveillance plays a key role in keeping them in check, through a process called immunoediting. Interactions between the immune system and cancer cells results in three possible outcomes. Elimination is the successful removal of cancer cells by the immune system. Equilibrium is the dormant state in which some cancer cells have not been completely destroyed but are not growing. Escape. In this scenario, cancer cells have escaped the immune control and they begin to grow. Eventually, these cancer cells may be discovered as a tumour. Many emerging cancer immunotherapies target immune pathways that prevent escape from occurring. Although elimination of cancer is ideal, attaining equilibrium may be equally effective in terms of patient longevity and quality of life. As the originators of the concept immunoediting themselves wrote, equilibrium may restrain the outgrowth of occult cancers for the lifetime of the host. Acute or short-term inflammation is necessary for health. Acute inflammation allows us to heal injuries, repair wounds, and to overcome infections. The key to the benefits of acute inflammation in this scenario is that it eventually resolves. Chronic systemic inflammation causes ongoing tissue damage, and this is associated with many chronic diseases, including atherosclerosis and cardiovascular disease. Insulin resistance, type 2 diabetes, dementia, depression, sarcopenia or age-related muscle loss, osteoporosis, and chronic kidney disease, as well as cancer. Minimizing systemic inflammation is an important goal of treatment to address chronic degenerative diseases in general, and cancer specifically. Accomplishing this is particularly challenging in cancer patients and survivors, because conventional cancer treatments often promote inflammation. NF-kappa B is a protein complex and influences many aspects of cellular activity by regulating more than 150 genes that are involved in inflammation, cell survival, and immune function. Chronic activation or dysregulation of NF-kappa B signaling is a critical factor in cancer and other chronic diseases. NF-kappa B overactivation is involved in cancer onset, growth, and metastases, and it contributes to treatment-resistant cancer cells. NF-kappa B is thus an attractive target to control the progression of cancer. A wide range of natural compounds have been shown to reduce the activity of NF-kappa B. One well-studied natural agent is the polyphenol curcumin. Curcumin is found in the root of turmeric, and it provides the familiar orange colour of curry spice blends. Interestingly, many other compounds from spices have been found to inhibit NF-kappa B, including capsaicin, quercetin, piperine, black cumin oil, and thyme. The effects of these compounds may be a factor in the much lower cancer rates seen in some countries where these spices are consumed daily, such as India. A small study examined a combination of curcumin and quercetin in 5 patients with a hereditary condition that's characterized by hundreds of pre-cancerous colon polyps. After 6 months of taking 480 milligrams of curcumin and 20 milligrams of quercetin 3 times per day, all 5 participants had a decrease in the number and the size of polyps in the colon. Overall, the average number of polyps decreased by 60%, and the average size decreased by 50%. Some other examples of natural agents that have been shown to inhibit NF-kappa B include chrysin, aloe, resveratrol, and epigallocatechin gallate, the green tea extract. Epigenetics is the study of how changes happen in gene function and how these changes are passed on through cell division to the offspring. In practice, epigenetic regulation dictates whether genes get expressed, turned on, or silenced, turned off. Epigenetic changes over a lifetime, due to factors related to diet, lifestyle, and environmental exposure, influence cancer risk. Furthermore, there's mounting evidence that epigenetic dysregulation leads to widespread modification of gene expression in cancer cells, and this plays a critical role in all stages of tumor progression. Unlike genetic mutations, epigenetic modifications are potentially reversible, making them especially compelling as targets of conventional and natural therapies. In fact, natural agents like green tea, resveratrol, curcumin, lycopene, soy isoflavones, and other appear to improve cellular function through epigenetic mechanisms. Tumor suppressor genes are segments of the genetic code that prevent and interrupt malignant changes in cells. If a tumor suppressor gene becomes damaged through genetic mutation or is inactivated through epigenetic mechanisms, cancer can develop and can grow unchecked. Perhaps the best known tumor suppressor gene is p53, which is mutated in more than half of human cancers. The polyphenols curcumin, resveratrol, and green tea catechins can reactivate p53 through epigenetic mechanisms in some circumstances. Similarly, natural compounds may help to reactivate other tumor suppressor genes that have been silenced through epigenetics. Cancer stem cells are cancer cells that have the properties of stem cells, namely, they can give rise to new cancer cells. The cancer stem cells may arise from existing cancer stem cells or from fully differentiated cancerous cells through a process called de-differentiation. They're thought to be responsible for treatment-resistant metastases and recurrence. Cancer stem cells are notorious for using multiple survival strategies to evade destruction by chemotherapy and radiation, such as pumping drugs out of their interiors, repairing DNA damage, resisting cell death signals, and entering a quiescent or suspended state. Several plant polyphenols have been shown to increase the sensitivity to cancer stem cells to the tumor-killing effect of the chemotherapy or the radiation, including curcumin, apigenin, and resveratrol. Targeting cancer stem cells directly with natural therapies is an area of great interest in cancer research. Agents like lycopene, resveratrol, garlic, genestin, quercetin, and ginger, as well as curcumin alone and combined with green tea, have shown promising effects in interfering with the survival and the self-renewal process of the cancer stem cells. Because the cancer stem cells also continue an inflammatory state in the tumor microenvironment by increasing the activation of NF-kappa B. Agents that block the NF-kappa B may also help to disrupt the tumor promotion by the cancer stem cells. Blood tests can be helpful in monitoring the effectiveness of cancer therapies when used along with imaging and careful examination. Some cancers produce molecules called tumor markers, and these can be detected in the blood and used to assess cancer activity. Tumor marker tests are not specific, however. This means that in some cases, non-cancerous sources of a marker can increase the concentration of the marker and produce a false positive result of cancer. Tumor marker tests should always be interpreted by a qualified healthcare provider. Hyperglycemia, or high blood sugar level, and type 2 diabetes has been associated with worse outcome in studies of people who have or have had various types of cancer. In addition, hyperglycemia is associated with lower immune function, and it can increase the risk of infection in patients with cancer. Both cancer and cancer treatment frequently cause hyperglycemia. Therefore, it's important to monitor glucose control using blood tests such as fasting blood sugar and hemoglobin A1C. Although the normal range for fasting blood sugar is 70 to 100 milligrams per deciliter, and hemoglobin A1C is normally below 5.7, some health experts recommend people without diabetes maintain a fasting blood sugar level of 70 to 85 milligrams per deciliter and a hemoglobin A1C below 5% for the optimal health. Cancer cells have long been noted to metabolize sugar into energy differently from the normal cells. Normal cells mainly use a series of reactions called oxidative phosphorylation, and this requires oxygen and it yields a high amount of energy per unit of glucose. Cancer cells mainly use a less efficient pathway called glycolysis that does not require and produces lactate as an end product. This metabolic phenomenon, in which the cancer cells depend on the glycolysis, even in the presence of oxygen, is known as aerobic glycolysis, or the Warburg effect, and it results in high glucose demand and an increased production of lactate by the cancer cells. Lactate dehydrogenase is an enzyme, and it's used in the final step in glycolysis. This enzyme is overproduced in cancer cells, and higher blood lactate dehydrogenase levels are seen when cancer cells are active. High levels have been associated with worse outcomes in patients with several cancer types, including lung, colorectal, prostate, gastroesophageal, gynecologic, kidney, and some breast cancers, as well as lymphoma and melanoma. Normal values for lactate dehydrogenase are 105 to 333 international units per litre, but these can vary slightly between labs. Importantly, several conditions other than cancer can cause these levels to rise. So high levels don't always mean that cancer cells are active in the body. The enzyme alkaline phosphatase is highly concentrated in cells of the liver and the bones, two organs in which various cancer types often spread. An elevated alkaline phosphatase level in the context of cancer is not necessarily helpful in characterizing primary tumors, but it suggests there may be metastases to the liver or the bone. In large meta-analysis of 19 studies, including 3,268 patients with various solid tumors, high alkaline phosphatase levels were significantly correlated with bone metastases. Alkaline phosphatase may be useful in addition to the tumor marker cancer antigen 15-3 for monitoring the recurrence of breast cancer. Elevated alkaline phosphatase levels are also considered a reliable indicator of bone metastases in men with prostate cancer. One study suggested that alkaline phosphatase levels of more than 90 U per L in men with newly diagnosed and untreated prostate cancer may indicate the cancer has spread to the bone, warranting a bone scan. Alkaline phosphatase is reported on routine metabolic panels as well as liver enzyme panels. If the alkaline phosphatase is high, isoenzymes can be ordered to distinguish the source of the alkaline phosphatase from the liver or the bone. The normal range for alkaline phosphatase can vary between labs, but it's usually 44 to 147 IUs per litre. Alkaline phosphatase levels are normally higher in children during growth spurts and pregnant women, and they can rise due to a number of conditions affecting the bone or the liver. Having a higher vitamin D level at or near the time of a cancer diagnosis results in improved chance of survival. One large meta-analysis concluded that higher vitamin D levels were correlated with a 26% lower risk of death and a 16% lower risk of disease progression in patients with cancer. In addition, vitamin D insufficiency and deficiency may have other negative health effects in patients with cancer, potentially increasing the risk of infection, depression, pain, and low quality of life. It's therefore recommended that patients with cancer have their vitamin D status tested periodically. Vitamin D status is assessed by measuring the levels of 25-hydroxy vitamin D. 25-hydroxy vitamin D levels of 30 to 50 nanograms per milliliter are generally considered healthy. Levels of 20 to 29 nanograms per milliliter indicate an insufficiency, and levels below 20 indicate a deficiency. Common complications and side effects of cancer and its treatment, like fatigue, neuropathy, immune suppression, and liver or kidney damage, can linger for years. An annual complete blood count, or CBC, and blood chemistry tests to check for anemia, immune competence, liver and kidney function, and blood glucose and lipid regulation is recommended in everyone who's had a diagnosis of cancer. Additional specific tests for nutrients that are commonly deficient after cancer treatment can include an iron panel, zinc, folate, and vitamin B12 levels. Managing systemic inflammation can improve the health and the prognosis in people with cancer. Several blood tests can help to gauge the level of systemic inflammation in patients with a history of cancer. C-reactive protein is a pro-inflammatory protein made in the liver, and it can be measured in the blood. High C-reactive protein levels have been associated with worse outcomes in a variety of cancers. While C-reactive protein production increases with inflammation, production of albumin, another protein made in the liver, often decreases. Tracking C-reactive protein and albumin at the same time can provide a better measure of systemic inflammation. A tool based on C-reactive protein and albumin levels, called the Glasgow Prognostic score, has a proven track record in predicting outcomes in patients with a variety of cancer. The use of C-reactive protein to albumin ratio has been shown to be useful for predicting the prognosis in some patients with cancer. A meta-analysis of 25 studies assessing the use of the CRP to albumin ratio found a higher ratio correlates with poorer outcomes for all cancers except colorectal cancer. Fish oil containing omega-3 fatty acids has been found to lower the C-reactive protein levels and to raise the albumin levels, having a positive effect on the C-reactive protein to albumin ratio in patients with gastrointestinal cancers. Platelets are blood cells, and they're known for their role in blood clotting. Platelets also influence the inflammatory response by releasing both pro- and anti-inflammatory chemicals, and by interacting with immune cells and microbes. Platelets can also be recruited and activated by tumor cells, and they're involved in stimulating the growth and the spread of cancers. High blood levels of platelets have been associated with poorer outcomes in many cancers. Fibrinogen is a protein that, along with platelets, is involved in blood clotting and inflammation. and it plays a role in cancer progression and metastases. A high fibrinogen level can be a marker for poor prognosis in patients with many different cancers. Fibrinogen levels are not checked as part of a routine lab test, but they can easily be added. For more information on the herbs and supplements that may be beneficial, continue on in the series. And for more information about herbs, supplements, and natural treatment plans, check out my website.